This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
All right, well, good evening, everybody. We take care of a lot of stroke or possible stroke patients, and we're always closely monitoring their blood pressures because you don't want them too high, you don't want them too low. So it's something we definitely do here. Now, there was an interesting study recently published in the New England Journal of Medicine, so big study, big journal, looking at EMS treatment of blood pressure in suspected stroke patients. So there's a lot of studies that look at taking what we do in the hospital and seeing if you do it even earlier in the EMS setting, does it make a difference? So what they did was they took a large number, like 2,000 suspected stroke patients, and they had patients who had blood pressure greater than 150, and they randomized them to either just kind of monitoring or more aggressive blood pressure lowering before they even got to the hospital. And they wanted to see if there was a benefit of improving function overall just by lowering the blood pressure in the ambulance. And the bottom line was that there was no benefit to treating this blood pressure aggressively in the pre-hospital setting. What was interesting is in this group, almost half the patients who were stroke patients were intracranial hemorrhage patients. And those patients did actually do a little bit better, which that makes sense. If you have a hypertensive hemorrhage, you do want to lower that blood pressure. But if it's an ischemic stroke, you don't necessarily want to lower the blood pressure. I think the bottom line is you can't really know what's going on before the patient, has their CT, and it's hard to know whether to treat the blood pressure. But it's kind of interesting idea to take what we're doing here and start in the EMS, but there was no difference with this intervention. All right, thanks, guys.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.